All right, so we're going to talk about taping for ankle swelling during pregnancy. So this is going to be a basket weave type of tape application. So I'm just going to measure this around her ankle, the idea being that we're going to create flow upward for lymphatic drainage. So as you have seen in other taping videos that we do, I like to cut the edges so that the tape doesn't peel off as easily. The easiest way to cut for edema or swelling in the ankles, which is common during pregnancy, is to cut 4 channels with your tape still connected at the ends. And then I'm going to start with just one tab, anchor that at the bottom of her foot, kind of trying not to touch the tape too much. And then we're going to be able to peel off all these little arms. And then as we tack it down on the upper part, we're going to add, so I like to do this all at once so I can kind of drive the tape in the right direction. I'm going to add a little bit of stretch to it and just tack down our little arms of tape and then bring that up the leg. So that's our first strip of tape that we're going to do for our ankle swelling. And we're going to repeat that. Actually, I'll use a different color so it's easier to visualize at the end. But this now will kind of show how quickly you can cut and apply that in your office. These don't really have to be perfect. And actually, tape is meant to be DIY, so you can do this on your own. And this isn't just limited to prenatal. This can be done on anyone with ankle swelling. So the key, the reason I'm showing you the second piece of tape is the key is to go in a little bit of a different direction with that. So with the ankle swelling, now we're going to go across the first strip of tape. We're going to come up in this direction and put our little arms down this way, this way, this way, and tack that up to the top, just like so. Okay, now we all know that kinesiology tape sticks better when we can rub it, but there's a little bit of a problem with rubbing this tape when it's all layered like this. So pro tip is to take the back of the paper and then you can rub on top of the tape without catching any edges. And the more you rub it, the better it will cure to the skin. So this basket weave tape application is going to help the tape, help the body as she moves her ankle and walks. It's going to create a pump for any swelling and fluid to come up and get processed up throughout her body. So I hope that helps. That's edema taping for ankle swelling during pregnancy. Okay, this is going to be a tape application to show you how to work with carpal tunnel pain during pregnancy or other times. So I'm going to take 2 strips of tape that are one is about equivalent to the length of my forearm. The other one is about equivalent to the length of my hand. Just some good rules of thumb. The more you tape in your practice, you'll start to know what sizes you need. So with the carpal tunnel application, with everything that I do, I like to round the edges. Little tip with that is if you keep the tape connected when you're rounding the edges, it's easier to toss. I'm going to also cut one piece of tape about halfway up the middle. And just because I like how it looks, I'm going to round those edges too. So this tape is going to come down into the wrist like so. So whenever we're taping a joint, especially upper or lower extremity, we don't want to cross another joint. And we don't want to have the tape be too long that it goes into her palm. So I like to start at the end point is something I always say. This is where I want the tape to end. So I'm going to peel these 2 little tabs. You can rip this tape anywhere. It's faster than trying to pick an edge off. Just take the paper off. And I'm going to have her add a little bit of extension in her wrist. So I'm going to plop those 2 tails down on her palm, not too far into the palm. The palm gets a little bit sweaty, so it's easier to not have it go too far in there. And then I can bring this up the arm, keeping that little bit of extension in the wrist, adding a little bit of stretch. If I did this and realized I have too long of a piece of tape and it's going into her elbow, the key there would be to trim this right now so that we're not trying to trim it once the tape's on her skin. But this is going to work just fine for her, so we're going to lay that down. Okay, and then like I've shown before, we can use the back side of the tape to help rub this so that it adheres a little bit better. Adding heat and friction to the tape helps it cure to the skin and adhere a little bit better. Then we're going to take our other piece of tape and we're going to cut the edges. We're going to actually split this one right down the center and pull that off in the middle. We're going to bring this up and around her palm. So I'm going to bring it up this way, add quite a bit of stretch, and bring it up like so. What this piece of tape is going to do is actually help open the carpal tunnel as it kind of recoils behind the wrist. It's pulling the carpal tunnel a little bit further open. So we purposely aren't overlapping that through the middle of the carpal tunnel. So then we can use the back side of the paper again to help that cure. There's not necessarily an order that you have to do this. You don't have to do this piece last or this piece first. You can play around with what stays on the skin better longer, and this will provide a lot of relief in the carpal tunnel in the hand. It'll also help bring fluid and swelling up into the body for the lymphatic drainage. So that's going to be carpal tunnel wrist taping for pregnancy or for any other time. Okay, so we're going to show you low back taping during pregnancy. This can be used during any time, but it's no secret that pregnant women have discomfort and pain in their lower back when they're pregnant a lot of the time. They also can have symptoms that radiate down into the legs. So one of the things I like to do is a pattern on the low back that looks like this. I call it an X taping, even though it's 3 strips. So I'm going to show you how to apply that. So each of these pieces of tape is just a little bit longer than my forearm. And as you've seen me do before, I'm going to round the edges before we start. This helps prevent it from catching on clothing. And I'm also going to show you some draping tricks. So first thing I like to do if your patient is wearing one is just utilize the bra, so I can just move her shirt up and out of the way and I don't need her to hold that for me. Because what she's going to need to do is hold this for me, because I want to be low enough that I'm at the top of the sacrum. This is also one of those tape applications pretty hard to do to yourself, but you can have a partner do it. Tape is used to be, is meant to be used at home. So Kira, I'm just going to have you kind of put 2 thumbs or fingers in there and just give me like an inch. Perfect. That's perfect. So we're going to throw this across her low back. I really want it to be centered. So I'm not going to start on one side and go to the end. I'm going to start in the center. So I'm just going to pull that apart. And like I've shown you, I like to kind of have the tape to work with. So I'll peel it almost all the way off, give that a little stretch, and I'll tack the ends down first. So then I'm going to use my hand to stick that to her body and then to her lower back. And then the edges, you don't really need to add any stretch. So you'll see I'll just peel that off and let that lay. And then the same goes, these are trickier, is we're going to go sideways, but I'm going to start that right in the center. And I'm going to lay the first piece down all the way up so that that's anchored. And then for this bit, I actually can just get that right underneath her waistband, really without having to have her take all of her clothes off or anything like that. And then the same on this side, we're just going to pop that in the middle. We're going to lay down that first piece, hopefully fairly symmetrically. Okay, I'm going to do something you should not do, which is pick the tape back up and start over, because if you do that, it really won't stick very well. But I wanted that to be more symmetric. Oh, look at that, major flaw. All right, and then we're just going to do the same thing over here, where we can just feed that below her waistband. So then I'm going to use the back of my tape to help that cure and stick better. When something like this happens, it's honestly up to you. This is not going to affect the tape job at all, and it's probably not going to bother your patient. If it bothers you and you want to fix that, you basically just have to take this whole piece of tape off and start over. Because if I take that off right now and try and straighten it out and put it back on, this just isn't going to stick. So you're going to have this end of the tape that's not going to stick. So I just leave little imperfections and blemishes in tape like that, just like that. So this type of tape application should stay on her for 5 or 6 days. With removal of tape, this is kind of a good time to show it. We want to remove the tape after the edges start to curl and starts to peel off on its own. We want to pin the skin down, and we just want to peel it off about 1 inch at a time. See how I'm right next to the skin? I'm just peeling that 1 inch at a time. That's going to be a lot more comfortable and leave less scarring, less chance of taking any skin cells with you versus taking that and just pulling it off away from the skin. So just nice and slow, peeling that off away from the skin. So that's low back taping during pregnancy. Okay, so this is going to be rib pain taping during pregnancy. During pregnancy, oftentimes babies' feet will be pushing and kicking. It's not uncommon up into the left side of the anterior rib cage. So there can be a lot of rib discomfort in through here and through the serratus muscles. There are lots of ways to tape ribs, but I'm just going to show you a pretty basic tape application because, again, this can be done DIY by yourself at home or if you're a practitioner in your office. So I've got two pieces of tape. One is going to go along the direction of the ribs and the other is going to go across. Most of the time in kinesiology taping, we do tape applications that have two pieces that bisect. Another alternative for rib taping is cutting one of these one more time and just spreading that out a little bit across the area. So I usually use, so the ribs are coming kind of down into this direction. And you can kind of feel where those interosseous muscles are. Ask your patient, you know, where does it hurt? It's right in here. I'm going to split that right in the middle. And I'm going to pop that tape down on her rib cage, a little bit of stretch, and roll that up in this direction. Now, sometimes this is fine. This is fine. If you're doing this at home, you've got one piece of tape, this is going to provide you a ton of relief. But if you want to go a little bit of that extra level, just take one of these strips, a little bit of stretch, and add that across your rib cage, just like this. And this tape will stay on for 4 or 5 days, stay on through showers, etc. And we're going to use the back of our paper. Pro tip, the more that you rub this and the longer it's on, the more comfortable it'll cure and it'll stay on a little bit longer. So as with most tape applications, when we're taking that off, we're just going to pin the skin down and give that a little roll. So again, it's going to be after 5 or 6 days. The tape's already started to crumble. We're just going to give this a little peel, holding the skin down and peeling in the direction of the tape. I don't really like to take tape off in the shower. I think the water actually makes it adhere a little bit more, like in the shower. So, so definitely taking that off when the skin is dry. So like I said, if you want to just use one piece of tape, that can be really effective in decreasing pain in the rib cage. All right, so I'm going to show you a tape application for diaphragm pain during pregnancy. Diaphragm pain is really common in terms, people describe it as numbness or a lack of sensation in the upper part of their abdomen, belly area. So Kira's going to lift her shirt just a little bit for us. This can be as long as you want it to be. Shorter is not better, longer is better. So I'm going to go with a little bit longer than my forearm, almost maybe even to my fingertips would be okay. I'm going to trim my edges like I like to do, make sure that doesn't get caught on clothing. And our goal is to create a little rainbow of tape right here. So I'm going to fold that in the middle so I know where the center is, peel the tape anywhere in there, and bring this almost all the way out to the ends. I'm going to flip the tape over so I can just apply it right across the top of the belly and create a little arc with quite a bit of stretch on it. I don't stretch the ends, so I just sort of let that roll off on the ends. And then I'm going to use the back of the paper to give that a little rub. It'll adhere a little bit more. You can actually see how the logo is overstretched right here, so that's just going to show you how much stretch I've added. That's going to actually just kind of add a little bit of comfort and compression to the top of the abdomen, which is just going to make her feel so much better. Because what's happening here is as the baby and the belly grow, the baby's feet are pushing out in the rib cage, and feet are usually pushing out up in here. Everything is pressure pushing outward, and so the tape is just adding a little bit of compression inward, but nothing too much. The body can still grow around all of that. So that's diaphragm tape during pregnancy. Super easy to do at home. All right, so we're going to show you a demonstration of taping for the pregnant belly. It's also known as the baby belt. There are two ways to do this. So I'll start with the more basic. With our less pregnant patient, we can start with basic, and the more pregnant our patient gets, we're gonna add 2 pieces of tape. So the first thing you wanna do is measure your tape. So I'm just gonna measure this. Go ahead and turn about a half a turn. Get that arm out of the way a little bit. And one more half a turn. So we're gonna measure it so that it's kind of up between the shoulder blades, but this is gonna grow quite a bit as you put it on the belly. So I'm gonna actually take about 4 inches off of that, and that's gonna be where I choose to start from. So we're gonna need 2 pieces of tape about that long. I'm going to round my corners, make sure that the tape doesn't stick to apparel and stays on as long as possible. And I'm gonna start my tab. It's always kind of tedious to try to get tape off this way, plus I don't really like to touch the tape if possible. It sticks better if we don't touch it. So I just tear that, then I've got a tab to work with. We're gonna go ahead and lift the belly up, or the belly this year. And I'm gonna tab this right under the belly. In fact, I almost always go just under the waistband. So it's just kind of right underneath the belly. You don't want to put tape right over the umbilicus or the belly button. So this is our trajectory, as you can see where I'm aiming that. So I'm going to take this, and because I like to have a lot of tape to work with, I bring it almost all the way out. And then I have my patient rotate a quarter turn and then another quarter turn. And then you can see that this is just going to come up. So draping and being able to tape under clothing is super important as well, just for our patient's modesty. So now I can just bring that right up underneath her shirt, and we're going to turn back around and start again. So I'll start with my tab, and I will really want to make that pretty symmetrical. Just go right under the waistband, right there. I'm going to bring a bunch of tape to work with, and she's going to turn about a quarter turn and another quarter turn. Beautiful. And you'll see how that tape sort of grew. So the idea here is that we're sharing, her back and shoulders are now able to share the load of the belly. Turn back around. So this is just helping her carry the load of her belly, almost like wearing a baby Bjorn once the baby's born, or a carrier. The weight is coming up from the shoulders to hold the baby, and it's not just sitting in the belly. So this would be a tape application that I would use for a not so pregnant person. Kira is, I've asked you this 3 times, 24 weeks. 24 weeks. And so that's a good tape application for her. Whenever I'm taping a pregnant person, a pregnant woman, I'm always thinking about the pros and cons. And sometimes tape can be itchy on their skin, or sometimes tape can just feel like another layer that they don't want on their person when they're warm or whatever. So I always weigh that. If the tape's going to be comfortable and it helps with the symptoms they're having, so for example, this tape application can help with low back pain, pubic bone pain, lower abdominal pain, upper abdominal pain. If that outweighs the itchiness or the heat of the tape, we want to use it. If it doesn't, we don't want to use it. So my point is, this would be the minimal version of the baby belt, so less is more. That's the point, less is more. Okay, but if we really need to add more, if the belly's really getting big, or the discomfort is significant, we're going to just cut 2 more pieces. We're going to round our edges, and we're going to add these onto the front. We're going to add these right here. Now I am going to go under the waistband for that, but pretty much a lot lower, so for informational purposes we'll keep it right there. And we're going to create just a little bit of an arc around the belly and bring it up here. And then for our second piece, same thing, just right about here. And we're going to bring that up and around. So those are great ways to just add a little bit of support using the back of our tape to rub that and get that to adhere a little bit better. So that's our baby belt tape application during pregnancy.